Welcome to What is Evidence-Based Practice? Many BOC-approved providers and athletic trainers are asking, what is evidence-based practice? The answer is simple. EBP is the combination of clinician expertise, patient values, and current best research evidence to drive the decision-making process for patient care. One of its most important purposes is to improve patient outcomes. The EBP model seen here is a classic illustration which outlines the integration of the three distinct parts. As a whole, the premise of EBP is to enhance reasoning and decision-making in clinical practice, which ultimately can improve the outcomes and cost-effectiveness of patient care. This concept of EBP is not new. It dates back to the mid-19th century. Many other professions have integrated the use of EBP into their practice. And over the past decade, several accrediting bodies, governing agencies, and healthcare payers have emphasized the need for EBP in healthcare. Unfortunately, through time, several misconceptions of EBP have developed. One of the most common misconceptions is that EBP is a blueprint on how to practice within healthcare professions and discounts the need for individual clinical judgment. More specifically, some healthcare providers believe that EBP creates a cookbook approach to clinical practice and will therefore produce cookbook clinicians. However, what is important to recognize here is that evidence-based practice is not a set of robotic guidelines, but instead an integration of three fundamental elements to enhance the clinical decision-making process. As we mentioned earlier, evidence-based practice not only uses the best available research evidence, but also incorporates the clinician's individual expertise as well as each patient's own personal values, goals, and preferences. Evidence-based practice is about practitioners combining their experience with other sources of evidence in order to make decisions which they hope will bring about better outcomes for their patients. This does not mean that research evidence of what works will automatically override the clinician's experience, although that expertise needs to be both reliable and valid. In other words, clinicians need to be aware of the limitations of their own experience in the decision-making process, particularly if that experience is not relevant to the task at hand. In addition to the cookbook misconception, EBP has also become a catchphrase for anything within clinical practice that can somehow be linked to an experimental study, regardless of the quality of the evidence depicted in the study. Again, it is important to remember here that the evidence-based practice process should include consideration of both positive as well as disconcerting evidence. By identifying and weighing both sides of the available evidence, and of course factoring in the clinician's own experience as well as the patient's goals, clinicians can make stronger clinical decisions as well as be able to more accurately discuss the benefits and caveats of such choices with their patients. Third, some individuals believe that to participate in evidence-based practice means to conduct research. Evidence-based practice is not about attempting to create new and generalizable knowledge through the conduct of research. Rather, EBP is about decision-making using the best available current evidence in order to improve patient outcomes. That does not mean that clinicians do not engage in some form of inquiry or evaluation of their impact on patient outcomes, but the emphasis is on both the improvement of the clinician's capacity and capability and better patient outcomes. In other words, EBP is here to help clinicians improve rather than prove. For the purposes of evidence-based practice and athletic training continuing education, there are two types of EBP programs available to athletic trainers. Foundations of EBP programs will help a clinician understand EBP methodology, find and evaluate evidence, and apply it to their clinical practice. These programs may focus on the who, what, when, where, and why of EBP and provide basic fundamental principles of the EBP concepts. Course examples may include what is evidence-based practice, how to incorporate it into your clinical practice, or using patient-reported outcome measures in athletic training. Athletic trainers who are new to EBP should attend Foundations programming to learn the basics. Clinical EBP programs are organized around a clinically appraised topic such as evaluation, treatment, and rehabilitation of injuries and illnesses following the 5-step EBP process. These programs are narrowly tailored and focused around a sound clinical question. The outcomes are focused on patients, not practitioners. Program examples may include concussion is treatable, a systemic approach to concussion treatment, or best practices in patellar tendinopathy management. This concludes what is evidence-based practice. To answer more of your questions, check out our other videos.